Now we go on to see the lobes of the liver. We talk of anatomical lobes and physiological lobes. This here seen on the anterior surface is attachment of the falciform ligament. This demarcates the right and the left lobe anatomically. And if we trace the same thing on the posterior aspect, we say that it passes through this line, which is nothing but a line connecting the fissure for ligamentum venosum with the fissure for ligamentum teres. Because of that, what we see is that the caudate lobe and the quadrate lobe are part of the right lobe of the liver, whereas this here small part is the left lobe of the liver. This is the anatomical right and left lobe classification. Whereas the physiological right and left lobes depend upon the blood supply, and therein the right and left branches of hepatic artery, the way they supply blood, that is how we define the right and left. The right hepatic artery supplies the entire right lobe, excluding the caudate and quadrate lobes. These two are supplied by the left hepatic artery, and thus physiologically the right and left is passing through the groove for IVC and the fossa for gallbladder, thus making the caudate and quadrate lobes part of the left lobe. That is the physiological left and right lobes of the liver. Apart from that, we also need to know the caudate lobe, which lies here just above the porta hepatis and between the fissure for ligamentum venosum and the groove for the inferior vena cava, and just below that lies this quadrate lobe, which is below the porta hepatis and between the fossa for gallbladder and the fissure for ligamentum teres. So two more lobes, caudate lobe and quadrate lobe. The caudate lobe at times shows a projection which is called as the caudate process, which is directed from the left to the right just above the porta hepatis. Sometimes there may be a Riedel's lobe, which is a small lobe projecting from the inferior border of the liver. So those are the lobes of the liver. Now let us see the various fissures which are seen on the surface of the liver. These fissures are seen along the posterior and inferior surfaces of liver. This here is the fissure for the ligamentum venosum above and the ligamentum teres below. Now let us study the bare areas of the liver. First is this attachment of the falciform ligament seen on the anterior surface. Then on the posterior surface, this triangular area between the posterior-superior border and the posterior-inferior border is the bare area of the liver. Other smaller bare areas are the groove for the IVC, the fossa for the gallbladder, the line of attachment of the ligamentum venosum and the ligamentum teres, and also the part of the porta hepatis. These all are the bare areas of the liver. Let us now see the ligaments of the liver. When we talk of ligaments, we talk of peritoneal ligaments and the true ligaments. Peritoneal folds which are seen here, one is this falciform ligament, second is the coronary ligament enclosing the bare area. When we see the lateral aspects of this coronary ligament, we see the right triangular ligament. Similarly, we see the left triangular ligament here as the left lobe tapers. Plus, we also have the ligamentum venosum and the ligamentum teres. So, all these are the peritoneal folds or ligaments of the liver. Now let us see how do we hold the liver in the normal anatomical position. For doing so, we need to introduce the forceps into the inferior vena cava and rest the hand on the inferior surface and hold the liver straight horizontally. This is how we hold the liver in the normal anatomical position. Thus, let us see what are the strongest supports of the liver. The strongest support of the liver are these hepatic veins which drain into the inferior vena cava and hold up the organ. Other supports would be the visceral organs which also help in holding it in the normal anatomical position, and also the ligaments of the liver. Now let us see what is the blood supply of the liver. The blood supply of the liver, 80% is done by the portal vein and 20% is done by the hepatic artery. Venous drainage from the liver goes into hepatic veins which are classified as superficial and deep. Superficial are 3 in number, right, left and intermediate, and deep also are 3 in number, 2 on the left side and 1 on the right, all of these draining into the inferior vena cava. The lymphatic drainage from the liver can be again divided into superficial and deep. Superficial lymphatics draining into the subdiaphragmatic lymph nodes, hepatic lymph nodes, celiac lymph nodes and the paracardiac lymph nodes, while the deep lymphatics drain into the hepatic and celiac group of lymph nodes. Now let us also see the gallbladder which lies here in the fossa for gallbladder. This is approximately 7 to 10 centimeters in length, 3 centimeters in width and has a capacity about 30 to 50 ml. Has 3 parts: the fundus, the body which narrows down to form the neck which continues as the cystic duct. When we talk of the fundus of the gallbladder, it is related just to the anterior abdominal wall and lies just behind the right 9th costal cartilage. The body of the gallbladder has got a superior and an inferior surface. This is the inferior surface which is related to the transverse colon and the first part of the duodenum, while the neck of the gallbladder is also having a superior and an inferior surface. Inferior surface is related to the first part of the duodenum, whereas the superior surfaces are related to the inferior surface of the liver, separated by loose areolar tissue. Blood supply of the gallbladder is done by the cystic artery, which is a branch of the right hepatic artery. Cystic vein drains blood from the gallbladder but directly pours its blood into the intrahepatic divisions of the portal vein and does not follow the cystic artery. The lymphatics from the gallbladder drain into the hepatic and celiac group of lymph nodes. So thus we have seen the gross anatomical features of both the liver as well as the gallbladder.